Children's Hospital of the King's Daughters is seeing more parents getting their children tested for COVID-19. That's causing a major backup in the hospital's emergency room and at its urgent care centers. And Sparaco shares what doctors want parents to know.
We want to make sure that the people who are sickest get seen the fastest.
Dr. Laura Sass with the Children's Hospital of the King's Daughters says more children are coming in with respiratory illnesses, creating long lines at the emergency room and urgent care sites. But there's another reason lines are continuously growing. She says too many parents are bringing their children in for COVID-19 testing.
There's been some confusion about where their parents can take their children to get tested.
Sass says she wants parents to know there are other locations where they can get their children tested for the disease.
If your child is not symptomatic, to take advantage of those regional testing sites, whether it's at the pharmacy or at the Military Circle Mall, Virginia Department of Health. As always, if your child is having any trouble breathing and can't catch their breath, you need to go either call 911 or go to the emergency department.
She says taking advantage of other testing sites will lighten the load on healthcare workers and shorten the wait for your child to see a doctor if needed.
Some of the staff weren't going to be able to leave until 1 or 2 in the morning because they wanted to make sure everyone was seen. The way we're going to do this is all by working together to make sure that we all take care of each other.
Dr. Sass says sites don't often test children ages 4 years or younger. She recommends you reach out to your pediatrician to find out how you can get your child tested for the virus if you feel they've been exposed. In Norfolk, Ann Sparaco for 13 News Now.
Dr. Sass says there's no timeline yet as to when urgent care hours will go back to normal. She wants parents to remember, if you think your child got exposed to COVID, it's best to test them within 5 to 7 days of when the possible infection happened.